Good afternoon, everyone. I'm just going to wait a few seconds. All right. Good afternoon, everyone. My name is Clara. I'm one of the physiotherapists at Wellness Embodied. Welcome and thank you for joining me. Today, I'm going to do a quick or brief introduction to head concussion and acute management of it. So, to start with, probably we should actually define what a head concussion is. So, the definition talks about having a blow. It could be directly on your head, but it could be also in any part of your body. And that blow should be strong enough to produce what we call making your brain shake within your skull. And as a consequence, the patient develops symptoms. All right. So something very important to understand is not all the head concussions produce loss of consciousness. So I've had a lot of patients that say, "Oh yeah, I've had heaps of head injuries, but I never lost my consciousness. So that means I didn't have a concussion." That's not correct. Losing your consciousness is one of the symptoms, but it's not like specific. Okay, so that doesn't mean that because you didn't fainted, you didn't have a concussion. It's very important to understand this definition that it doesn't have to be a direct blow on your head. Even a car accident where we have a whiplash and our neck is moving in a very fast speed into two different positions, that can also produce a concussion. And another thing that is very important to understand is that in a concussion, we don't have a structural damage. We only have functional damage. What does it mean? Usually, when we have a head injury, we go to the emergency department, they do MRI, and nothing shows in the MRI. So the doctors say, "Oh, your MRI is clear, you're fine, you can go home." So what they're looking for a structural damage, like bleeding or any damage in your cells. So that's a different type of head injury. A concussion is mild, so the damage that is produced after this mild injury is just everything gets stretched, your brain gets shaken very quickly, and it will affect the function of the cells of your brain, but not the actual structure. All right. So that's another thing that's very important to understand. Not loss of consciousness doesn't mean that you didn't have a concussion, and not having a normal MRI doesn't rule out a concussion either. Okay, so the most important thing what can tell you have a concussion is your mechanism of injury. If you had a direct blow, even if you didn't faint it, you had a concussion. If you had a whiplash, probably you will develop a concussion or you also had a concussion. So those are two very important terminologies that we need to understand. Then, again, does it have to be directly on your head? No. Any impact on your neck, any impact on your body can make enough forces in your skull to produce symptoms. And I also would like to help you to understand this a bit better. So here I have our little friend. So this is a skull. He lost it. All right. So this is a skull. Yeah. If we had a chop halfway, we'll see what is inside. Yeah. So our brain is floating in this skull like a jelly. All right. We always compare the brain as a jelly, the consistency of a gelatin. Yeah. And it's floating on liquid. So when we have an impact, that means direct blow or any quick movement on our neck, that jelly is gonna move. It's gonna move forward and backwards or side to side. Yeah, and that movement, that quick movement, would be enough for every single little brain cell of our brain to turn on. Yeah, and that's gonna send a lot of information, and we call that excitatory stimulus. That is going to happen. All right. The problem with the concussion is that everything happens at the same time. Usually, for example, if I want to move my arms, certain areas of my brain are going to work saying, okay, Clara wants to move the arm, we should move this muscle, we should move this joint. But what happens with concussion is that every single part of the brain gets excited. So that means that our brain is going to use lots and heaps of energy. And after using all that energy, what happens is it gets out of energy because it used everything too quickly, too sudden. So then we call like excitatory phase. You have the concussion, every single part of the brain gets stimulated, and then we get into a depression phase where we don't have enough energy, and that's when patients start developing symptoms. And guess what? One of the most common symptoms of concussion is fatigue. Everybody that had a concussion, almost everyone says, I feel very tired, I can't finish or do the same hours at work that I used to do, or the kids can't concentrate, or people feel like they need to sleep longer, or they feel they are not themselves anymore. And that's because they are in that depression stage. That means the brain has no more energy and needs time to recover and go back to normal functioning. So what is important to know as well is that in humans, the studies and the research has said that we might take up to 4 weeks to go back to the normal energy level of the brain. So that means we had a concussion, we use all the energy, we get into the depression phase, and then it might take us 4 weeks to go back to normal levels. So those 4 weeks, since the concussion until we recover full energy, are very important, because if we have another concussion while our brain is still recovering, we can make it worse. We can make the energy level even lower, and some people can end up with a permanent damage. So that's why it's so important. If you suspect you have a mechanism of injury, you should go straight away to see a doctor, to the emergency department, or to see a health professional that is trained to manage concussions, so you are instructed of what to do. It's very important to avoid having a second concussion within those 4 weeks, because otherwise you can end up with a permanent damage. So once you have the mechanism of injury and you are not 100% sure of if you did not have a concussion, I'm gonna describe the symptoms for you, so that can give you another idea. If you recognize any of these symptoms in yourself or in someone that you know that might have a concussion, it's very important to ask for help and look for assistance straight away. So as I said before, one of the most common symptoms is fatigue. Some patients have problems sleeping, or either they sleep too much or they keep waking up at nighttime, so the sleeping pattern changes. They get changes in the mood, they get cranky very easily, or they cry very easily. A lot of patients feel, I'm not myself, I feel different since I have this problem. Some others might develop headaches or nausea, they feel constantly nauseous. They get dizzy, they probably are like, oh, my balance is not right. They can also have problems in concentration. That's another popular one. They feel like they can't keep up with work, they can't follow a conversation with the family or friends, they can't work in the computer as long as they used to. So all those, even if you have only one sign, that's already or one symptom, that's already a sign for us that if you have the mechanism of injury and you're already having these symptoms, you definitely had a concussion. And that's when you definitely need to go and see a doctor if you haven't done it before. So how can health professionals help you? So we have a plan. We follow protocols for patients that have concussions, depending which stage they are. How, let's say, if you are the second week after concussion or you are 3 months after concussion, there are different protocols that we follow. If you had a concussion, it's very important to go as soon as you can, because the sooner you go, the less chances of developing a chronic post-concussion syndrome. So, as I said, usually we take 4 weeks to heal. Within those 4 weeks, there are strategies and therapies that we can give you to increase the healing, to ensure the healing, and to avoid prolonging the lasting of your symptoms. If it happens that you had a concussion 3 months after you look for help, we can still help you, but the protocol is different. However, my job today is to try to convince you, as soon as you have a concussion, go and see some help, because we can help you and we can avoid making those symptoms lasting for too long. Some of this, in those protocols, we guide patients to go through how to return to work, how to return or go back to school. Sometimes we need to change the hours, sometimes we need to include some breaks. So everyone's different, and not everything works for everyone. That's why it's so important to look for assistance, so we can give you the right treatment at the right time. So that's all for today. It was just a brief introduction of an explanation of what concussion is, what happens, and why we need to look for help. In the next few weeks, we're going to be explaining a bit more in detail what is the treatment about, and what the protocols are, to explain about the protocols we use also for patients to return to work or to sports. Because, yeah, as I said, not everybody is ready to go back to work or sports straight away. So if you have any questions, please let me know, and keep tuned, because we will have more information coming up in the next few weeks. Thank you for joining me. Bye.